Can you take us through the progression of symptoms that someone would develop if, in fact, he or she is bitten by a rabid bat?
Yeah, that's a great question. I mean, the tragedy in this case is that we have a gentleman who's died of rabies. And we want to emphasize that once symptoms develop, rabies is universally fatal. So the key is, if you've been exposed to a wild animal, if you're concerned about having saliva contact or being bitten by a wild animal, seek medical attention immediately. You're not going to be able to self-diagnose rabies, and so it's important that you talk to a medical professional. And effective treatment is 5 injections before symptoms develop. If someone progresses to rabies, it's a neurologic disease. So people develop neurologic symptoms, including confusion, abnormal behavior, or nerve symptoms in the part of the body where they're bitten, pain, numbness, weakness. Because it's a rare disease in the United States, it's really important that we focus on prevention, because we're going to prevent rabies from happening by providing treatment at the time of the bite or the exposure to the wild animal. And once symptoms develop, it's universally fatal.
Can you talk about latency period for that onset of symptoms or the illness?
Correct. So after a bite or exposure to a wild animal, the incubation phase is about 2 to 6 months. And so seeking treatment as soon after contact with a wild animal is the most effective way to prevent it.
Are you concerned that there are people today who may be infected, don't know it, because of this individual?
I'm going to defer, I think, to Erica, just because she knows more information about the investigation.
Erica, if you could tell us maybe, again, the number of people you think were exposed and the number of people who have actually sought preventive series of shots.
So based on our interviews with family and friends of the individual, there were 4 people that we identified that may have had contact with his saliva or other body fluids. 3 of those did, and we offered post-exposure prophylaxis or precautionary treatments to them, and they received those injections.
Can I infer from what you guys have said that this individual did not report the bite and did not seek medical treatment? Did he not know he was bitten?
So correct, the individual did not notify anyone that he was bitten. He did not seek medical treatment. It's unclear whether he knew he was bitten. He certainly handled the bat. You can see from the bat, the taxidermied bat here, that the teeth are very small. He clearly handled the bat. That is the information that we have, and based on his rabies death, we assume that the bat bit him.
Could you turn that so we could see it? Thank you very much.
Can you be more specific as to where he came in contact with the bat and the circumstances surrounding that?
So that particular incident happened in the southern part of Contra Costa County. Bats are everywhere in Contra Costa County. We get bats tested from all parts of Contra Costa County. We've had 3 bats tested positive for rabies this year, and those bats have been from central and south Contra Costa County.
When you say south, is there a way to put a town name on it or a location where this bridge was, what they were handling the bat at?
So the southern part of the county includes Danville, San Ramon, Alamo, all of the cities down there.
So you're not saying what city?
We are not. Because bats are everywhere, and this particular bat we're not going to find, and so we're interested if anyone has had contact with bats in the past 6 months that they contact their local health officials.
Are you getting calls though of it like on the street or in someone's houses? You know what I mean? Where do they show
Yeah,
up?
the calls that we get, and as well as Animal Services gets, are the bats are found dead on the ground, in the backyard, once in a while in the buildings, but the bat could be anywhere.
Was his bat in a public, like a park, or did you say a bridge? Can you be more specific?
It was outside. He handled the bat outside.
Now, my question was, could there still be individuals who have been exposed through the saliva of this man, who are not yet symptomatic?
So human-to-human transmission is theoretically possible, but very, very rare, and usually only happens in the case of transplanted organs from one rabid individual to a non-affected individual. We did extensive interviews with all the family and friends and tracked his movements very carefully, both within Contra Costa County and as part of the international investigation.
And in the international investigation, there were people sitting next to him on an airplane.
Correct.
I recognize that some of those people have been identified. Has everyone been identified who has had contact with this man?
Everyone in the Contra Costa, we were in charge of the Contra Costa portion of that investigation, and the rest of that question I will defer to the Centers for Disease Control and Prevention because they were involved in the international component of that investigation.
So you're not talking about sharing a soda or something like that in terms of contact, I mean, you're talking about transplanting, I mean, there's a big divide between you're
Yes.
sitting next to someone and they take a sip of your water versus you had surgery and you took one of those.
Right, saliva from the rabid individual has the rabies virus in it, or from the rabid bat, and that needs to get into the mucous membranes or into the bloodstream of the individual.
So can it be done through, as my colleague suggests?
The rabies virus does not live for very long in the air, so that probably wouldn't be the way that transmission would happen.
So how is it spread in planes, or how could it be?
That's a question for the CDC. That was their portion of the investigation, and that was based on their rabies program recommendations.
Would you call that like an abundance of caution, so when we're talking about other people and exposure?
Correct. I think part of it is we wanted to be very diligent in identifying any contacts because rabies is so often fatal.
And is there a reason, I mean, I know you said that bats are everywhere, that it feels like you're trying to, is it not say it was found on the street or in this park, or just to let people know that there was a rabid bat found right there? Is there a reason not to be more specific about exactly where this bat was found?
I think part of it is not to focus on this particular bat because there are bats throughout Contra Costa County. We really want to get the message out that if you see a bat anywhere, that please do not touch it. And if you have touched a bat, then please call us at Contra Costa Public Health.
And the 4 individuals you identified, are they family members, or why would they be singled out as people with special interest?
They were family and friends.
Can you tell us more about this individual, and is he a student, is he married, does he have kids? I mean, it's hard for us to tell the story. I mean, people are gonna care more about it, frankly, and pay more attention to it if they know a little bit more about who was lost here.
All we can say is he was a 34-year-old man who lived in central Contra Costa County.
I take it his family doesn't wanna get involved.
They do not at this moment. If that changes, I will let you know.
There's a mention about a Texas home as well. Did he have a couple residences, or is that a different?
At some point, he did live in Texas, yes.
Dr. Shaw, can you explain why, after you develop these symptoms, that it's fatal? Why is it fatal once you develop these symptoms?
Sure. So once you develop symptoms, it's fatal because the virus has entered the nervous system. So the way a bite leads to illness is the bite enters the skin and then enters through the muscle. During that time frame, that incubation period we talked about, receiving immunoglobulin and vaccination, which is the 4 shots in the arm for the vaccination and the immunoglobulin, prevents that virus from getting into the nervous system. Once it's entered the nerves in that region of the body, it travels to the spinal cord and to the brain. Once it gets into the spinal cord and the brain, that treatment, the immunoglobulin and the 4 injections with the vaccination, are no longer effective. And so that's why once symptoms develop, it's almost universally fatal.
Are there misconceptions about a rabid bite that people still have? Or, you know, that I'm feeling kind of, you know, sweaty, but that's okay. I'm sure I'll get over it. I mean, are people in denial about the potential fatal aspects of getting a bite from a rabid bat or animal?
So no one's going to be able to self-diagnose a rabid bite versus a non-rabid bite. The message really for us is if you have contact with a wild animal and you've been bitten, seek medical care immediately. Because I can't give you any specific symptoms or feelings you might have to tell you that this is a rabid versus non-rabid. I may defer to Curtis about myths about rabid animals, but I don't, you know.
What's the survival rate once you get a shot? I mean, if you get these 5 series of shots after a bite, I mean, is it 100% that you will survive this?
It's very close to 100%. I mean, I don't know the exact number. Do you have?
I don't know that we've ever had a breakthrough of rabies vaccine for someone who has started treatment before they become symptomatic.
So a bite doesn't automatically lead to death from rabies. And so there's a certain number of people that will go on to develop rabies, but we can't tell who that is, either based on the animal or the symptoms that they have, you know, immediately after a bite. So that's why everyone who's been exposed to a wild animal who's been bitten and presents for medical attention should be assessed to receive prophylaxis.
So no natural immunity as far as you're aware?
No, there's no natural immunity to rabies.
And
how does this work? I mean, if somebody is bitten, starts, like in this case,
Mhm.
it seems as though it's so rare that if somebody went to a doctor with issues like this, it might not be necessarily addressed, or it might be missed or misdiagnosed. Especially
So-
if they started to have symptoms, like this guy had numbness in an arm and some pain.
So the important message for me is that if you've been bit or you're exposed to a wild animal, you seek medical care immediately and talk to the medical professional about your concern for having been bitten by an animal. As Curtis mentioned, it is required by law to report that bite to the local public health department, and we have available resources to all the emergency facilities in our county if they have a question about how to treat rabies, might this be rabies, and we also have animal services available to assess an animal if a family is concerned that a certain animal may be at risk.
So any bite, any exposure to a wild animal has to be taken very, very seriously.
Absolutely. We want people to, yeah.
And can people pick up a dead bat in their yard and be safe, or is the transmission still possible?
We would not recommend handling any
Okay.
dead animal, and we have resources to contact animal services who can assess.
What did they do with the bat? I mean, it was in a plastic bag, and they touched it, and what happened, as far as you know, the bat, they threw it away?
Yes, according to the story, it got thrown away.
You know, did they ever say why he would put his hand in there?
They did not.
Or why they were handling bats to begin with, under a bridge.
I think many people don't know the risk from rabies, and you can see from the taxidermy bats here that Mexican free-tail bats are fairly small. Some people may think that they're cute. Some people may be interested in touching wildlife that will allow them to touch it, but we would recommend never touching a bat no matter what the circumstances are.
Are they elsewhere in the Bay Area? So they were in SoCal, Mexico, and Contra, Costa County. Are they other places around here?
I'm going to defer to Dr. Curtis Fritz here.
The Mexican free-tail bat is probably the most common bat in California. There are a few places in California that you won't find them. From a rabies perspective, we test, as I said, up to 2,000 bats a year, and I can tell you 50 to 60% of the positive bats that we get are Mexican free-tail bats. So in terms of bats and rabies in California, this is the culprit.
These bats live in a large colony, as we know.
They are colonial bats, yes.
Can you talk about the pressures from the colony to expel ill bats and why that may be a risk for humans?
As Dr. Shaw mentioned, the rabies virus affects the nervous system, and it's the same for humans as it is for bats as it is for dogs. Bats that are infected with rabies the typical thing is, depending on where in their brain the rabies virus actually develops, they'll begin to behave unusually. And by unusual, it would be things such as bats that are out active during the daytime, bats that are on the ground, bats that are not acting normally, pretty much. So, any bat that is not behaving bat-like is a potential source for rabies and should be suspect.
Okay, so to clarify the numbers, 1 to 2,000 are tested in California. and
Bats, yes.
200 test positive, and up to 10 in Contra, Costa County in particular, a year test positive, 3 this year. I'm just trying to make sure that I have that.
Yeah.
And Curtis, what was the last fatality in California?
The last fatality that we had in California prior to this current one was in 2008. That was a Santa Barbara resident who was exposed to dog rabies while visiting Mexico.
Oh, okay.
And I should mention that of our cases here in California over the last 20 years, approximately half of those have been imported cases, persons who are exposed principally to dogs outside the United States. The other half would be those who were bitten by bats here within California.
Dr. Fritz, a lot has been, I guess, developed since the time I was a kid. Rabies, post-exposure rabies treatment was said to be very, very painful. That nobody wanted to go through that. Things have changed since then, or is it still very painful?
Considerably. Rabies vaccine is no more painful than an influenza vaccine or a tetanus vaccine or any other vaccines. It is a series of 4 injections, actually 5 injections, 4 of vaccine and 1 of immunoglobulin.
What have you seen, though, in the changes in the prevalence of this?
Over the last 10 to 15 years, rabies in our animals in California has been fairly stable. Bats overwhelmingly are represented. We have a fair number of skunks each year, and then all the other species, including domestic animals, a very, very small percentage.
These other animals?
Of the animals that we test every year, of those that are positive, 80-90% of those are bats.
Are these bats that would be aggressively?
No, these are insectivorous bats. These are bats that feed on insects. They have no interest in. They're not vampire bats. They don't feed on blood. So yes, they would typically not. They would typically shy away from human contact.
So most of the contact would be a person approaching a bat out of curiosity, as
Right.
opposed to.
Yeah. So if a bat allows you to approach and touch it, there's something wrong with that bat.
And you said that the teeth are so small that you might not even know you were bit.
The teeth are very small. I have never been bitten by one, but I understand that you do feel it. It feels like a bee sting. But one of the concerns that we have with bats is people that may be bitten while they're asleep, unconscious, inebriated, and may not know that they were bitten. The teeth are very small and leave very marks that are very hard to find if you're not already looking for them and aware of it.
What if a bat accidentally runs into you in the dark? This happened to me last night. A bat came really close. It went like this. And will they ever like accidentally knock into you and then you'd be infected? Or?
We don't generally consider contact with the outer surface of a bat as posing a risk for rabies. The rabies virus is present only in saliva and neural tissue. So as long as there was no bite inflicted, there would not be consideration for rabies transmission.
And then humans can only pass it through saliva and other bodily fluids.
As was mentioned earlier, there's been no well-documented case of human-human transmission through saliva. So rabies virus has been detected in saliva of human rabies patients, so we know that it at least is a theoretical risk. But from a practical standpoint, as Dr. Shaw mentioned, the only human-to-human transmission that has been documented to date is through organ transplant.